Welcome to This Week in Health IT. It's Newsday. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Special thanks to Sirius Healthcare, Health Lyrics, and Worldwide Technology, who are our Newsday show sponsors, for investing in our mission to develop the next generation of health IT leaders. We set a goal for our show, and one of those goals for this year is to grow our YouTube followers. We have about 600 plus followers today on our YouTube channel. Why, you might ask? Because not only do we produce this show in video format, but we also produce 4 short video clips from each show that we do. If you subscribe, you'll be notified when they go live. We produce those clips just for you, the busy health IT professional. So go ahead and check that out. Common question I get is, how do we determine who comes on This Week in Health IT? To be honest, it started organically. It was just me inviting my peer network. And after each show, I would ask them, is there anyone else I should talk to? And then the group, obviously, the network grew larger and larger. And it helped us to expand our community of thought leaders and practitioners who could just share their wisdom and expertise with the community. But another way is that we receive emails from you saying, hey, cover this topic, have this person on the show. And we really appreciate those submissions as well. You can go ahead and shoot an email to hello@thisweekinhealthit.com. It will go to the entire team. We'll take a look at it, reach out to these people, and see if there's a good fit to bring their knowledge and wisdom to the community as well. We also launched Today in Health IT, a weekday daily show that is on todayinhealthit.com. We look at one story each day and try to keep it to about 10 minutes or less, so it's really digestible. This is a great way for you to stay current. It's a great way for your team to stay current. In fact, if I were a CIO today, I would have all my staff listening to Today in Health IT so we could discuss it. You know, agree with the content, disagree with the content. It is still a great way to get the conversation started, so check that out as well. Now, on to today's show. Today, we are joined by Frank Nydam, the VP of Global Healthcare at VMware and the winner of the referral program for ClipNotes last fall. And Frank, welcome to the show.
Oh, thanks for having me. Long-time listener.
I just have to start by thanking you. We launched the ClipNotes program in the fall, which is the email distribution list where 24 hours after we do a show, you get an email. It has the summary, has bullet points, then has the 4 video clips with it. And we now send out close to 1,800 emails every week. And I really appreciate all the referrals that you gave to the program. So I just wanted to give you a big thank you from me and the team for that.
You're welcome. I've always been a big supporter of what you're doing. And, you know, we as a IT partner vendor, we always looking for more information about what's on the mind of the healthcare CIOs, and your service and your information is always great. So I appreciate it.
Well, thanks. Thanks for coming on the show. Do you do a lot of these? Do you do a lot of podcasts and that kind of stuff, or is this pretty rare for you?
No, we used to do. I used to do many more. So not too much. I was looking forward to this. It's been a long time. I've been stuck in my basement so long. It's nice.
I love your basement. For those listening on the podcast, you're going to have to check out the video. You have the multiple guitars going, and any stories behind the guitars. You play pretty extensively.
I do. It is funny how COVID and Zoom has introduced me to so many other people that play instruments, especially guitars. I see guitars hanging on the wall, and some of them are decoration, but I like to say I use them. It was a thing I picked up in college a long time ago, and I'm over 50, and we've got the over 50 band that plays in my garage and some pubs. Looking forward to getting back out there.
We can put together a health IT band that plays at the CHIME event. So so you'd be the guitar player, and we just need to find a bass, a drummer. Who do you think would be the best CIO lead singer that you could think of?
Aaron Meary.
Aaron Meary as the lead singer. We'll have to come up with a name later. I can't imagine, and I don't want to offend anyone, so I'm going to be careful here. All right, let's go ahead and step into this. We are going to talk about the news, but before we do that, you were a part of the planning committee for the upcoming CHIME conference. Is that right?
Yes, that's correct. I was.
All right. So this, I'm going to hit you up for some insider information here. We're going to cover the agenda. This is an all-star cast. A lot of former guests of This Week in Health IT, but it's a phenomenal set of speakers. You know, what can you tell us about the planning process for this?
I think it goes without saying, we all missed getting together, and that was probably the best thing, and it still is the best thing about CHIME, the fall forum, the spring forum, seeing everybody, shaking hands. And I know John Kravitz and Darren Dworkin and the committee really wanted to do something completely different this year. And, I think we're all Zoom fatigue. So, we just got an all-star cast. I mean, from the opening, having Cerner, Epic, and Meditech on stage together. I think we've all sort of been waiting for that for a long, long time. And I mean, some of the folks on the other panels, the big tech speaking, Amazon, Microsoft, and Google. So just wanted to completely rewrite the script of what CHIME Spring Forum is going to be. And again, since it is virtual, this is going to draw a lot of people. I think we're going to have a really good conversation, many great conversations.
Yeah, so I imagine there's a lot. You want to draw people back, but you also want to create that experience. But one of the things we like about the spring and fall forums is we get to rub shoulders with each other and have conversations and just catch up and those kind of things. Are we going to be able to create that kind of environment with a virtual setting?
There's been a lot of attention to that. There's some suites there where you can get together and have outside conversations, questions from the audience, pre questions. So I think it will be good. Again, there's only so much you can do on Zoom, and that's why we really wanted to focus on these great leaders.
All right. Well, let's hit some of these. The opening keynote panel should be very interesting. You have Judy Faulkner, Howard Messing, Judy, CEO of Epic, CEO of Meditech, Howard Messing, and CEO of Cerner, Brent Schaefer, with Darren Dworkin as the moderator. That's an all-star panel. I'm not sure I've seen that group on a stage together before. What's the topic? Future vision for health and care. What's coming over the horizon? I guess this will be from an EHR provider perspective. What's coming over the horizon? That's a good way to start this thing out. That's pretty impressive.
Well, then right behind it, right? You have the three big tech leaders, public cloud behind that. That should be even more interesting. I think they build upon each other for sure.
Yeah. So you have Google, Microsoft, and AWS. You have Phoebe Yang, David Rue, Dr. David Rue, and Ashima Gupta, who with Google, with Daniel Barchi leading that conversation. Again, this is some great panels. And then in the afternoon, you have post-COVID trends shaping healthcare. You have Helen Waters with Meditech leading a conversation with Atrium Razu Shrestha. He's almost like Cher. You just have to say Razu and everybody knows who you're talking about. Jim Noga with Mass General and Teresa Meadows. And again, another phenomenal panel. And I'm going to slide some of these other panels. We're not going to go into all of them, but there's, again, Halapka and Rosenberg. You have Joel Venko, Karina Edwards, all former guests of the show are going to be there. I highly recommend people sign up for this. It looks like it's going to be a phenomenal discussion. So that's what is it, 3 days, 2.5 days?
Yeah, I tell you, once some of these folks started signing up and the vision that John and Darren and the team put together, we were really excited about this. It's coming together great.
Yeah. So should be good. Just out of curiosity, what do you think the future of these kinds of conferences are? Do you think we'll get back together soon? And do you think we'll hold on to some of this virtual moving forward to make it accessible?
I think the human part of us wants to come out and shake hands again and see people. Yeah, so absolutely. I think we'll all be getting back together. When? Who knows? I think there's a lot of, everybody keeps calling me saying, are you going to HIMSS? Will you be there? I'm going, I'm not going. So yes, I think there's a deep desire out there. But on the other side, I think the virtual platform allows you to connect to a lot of folks that you wouldn't have connected to. I think it's an interesting byproduct that we're seeing from our marketing and outreach team from a VMware perspective is where we used to see, maybe 1,000 people, we're getting, 10,000 people seeing this. So it has its drawbacks as well, but I miss seeing people. I know you miss seeing people, and that was always what drove us to CHIME and continues to drive us to CHIME with that interaction. I think that's how you and I first met.
Yeah, yeah, absolutely. The HIMSS conference is it July? Is that right?
You know what? I'm not sure the date is of that, Bill.
But it's right on the edge of what everyone feels like is the time frame that we're all going to get back together. It feels like if it's going to happen, it will be just over the line where we feel like, all right, it's safe to go back into the water. But because it's on that edge, I think everybody has that question of, is it too early to be doing this? I know that the fall CHIME Forum in San Diego, they're planning on doing that live, but that's like October timeframe, right?
Correct. But I think this whole conference industry sort of needed this shakeup. It was getting sort of repetitive. You knew when these things were happening, and I think the virtual piece has actually helped it a little bit. I think we need that human interaction, but every once in a while you need to shake the snow globe and see what comes out of it. I think we'll be good for this.
So the pandemic was shaking the snow globe on the conference industry, and I agree with you. It had gotten kind of stale. The conferences. Some of the conferences were sort of petering out. Some were still thriving on history, really, for the most part. So we'll see how this whole thing shakes out. I don't suppose I'm going to get you to say anything, really controversial here about the future of where conferences are going to go.
No, I will say there's, like I said, maybe the snow globe piece, the HLTH conference and their organizers have been great. I think they're thinking outside the box, bringing a lot of startups in. We participated for a couple of years. I think last year, Judy spoke at that as well. So we had a lot of government representatives. That's another one. I think it's a great output of this.
Well, the thing they've been able to do at that conference is they're bringing not only healthcare providers, they're bringing pharma, they're bringing big tech, they're bringing the insurance plays. They're literally bringing the whole ecosystem together to really have conversations around what we can do to move healthcare forward. And I think that's really their strength. And if I look back, I went to the first one and the second one. I think those were the only two that were live. But the first one I went to, I think I was one of only maybe 3 or 4 CIOs that I can remember being there.
Yeah.
And healthcare wasn't really well represented from an IT perspective. The next year, healthcare was better represented only because they had a whole bunch of CEOs and leaders from healthcare up on the stage. That's the last time I heard Bernard Tyson speak, and he gave a phenomenal talk. And I think he died like just a month or two after.
I felt old at that first HLTH. I was walking around with a lot of startups, which is really interesting. I think they had if I remember, they had a nice Shark Tank type of thing on stage and pitching their ideas, and it was, that's still excites me about healthcare is, what are they thinking about in the proverbial virtual garage? There's some outlandish ideas out there, but maybe it's the snow globe analogy as well.
All right, well, let's go into one of those startups, and it's probably the loudest startup in quite some time, and that's Transcarent. So Transcarent is Glen, Tullman, and teams. I don't want to slight any of his team members because it seems like Glen's pulling a bunch of the former Livongo people over and former Allscripts people over. And, Transcarent is an interesting model. They are essentially going into the employer space, into the self-funded employer programs, and they're offering a suite of services around care delivery. And it's really interesting. It's a technology play, so they provide information, but it's also a connection play and an experience play in that not only do they wrap the technology around it, but they will connect you with care. They will follow up with care. And their financial model is very different from anything we've seen before. They are essentially going to baseline an employer's current costs for their program, and they are going to take a percentage of the savings over and above what they're able to save them. And because they understand healthcare so well, they are going to be able to do some things I think that are interesting to drive costs out of the equation. The redundant testing, the inefficiencies that just naturally exist in healthcare. And so Transcarent is interesting. They're going after that space that's a fairly lucrative space. So have you gotten a chance to take a look at Transcarent yet and what they're doing?
You know, a little bit. That whole space fascinates me. I was actually having a conversation with my wife about this in preparation for this call. We were chatting about, her experiences recently in the healthcare system, and, how we all sort of it's always the gaps, right? The providers do a really good job here. The payers do a really good job here. But it's those gaps. It's the handoff. It's the patient experience, the consumer experience. It's I just had my annual physical yesterday, and my cardiology report still isn't getting over to my primary care physician. So I would say they're doing a good job in attacking those gaps between all these places, between all these, whether it be the technology, the payers, the providers, everything. And I think that's where they're doing a really good job.
It's interesting to me because if we just talk through the experience, and this is when people say healthcare is broken, this is what they're referring to. They're not saying, hey, I don't like my physician and I don't like my hospital and I don't like, the care that I receive. Generally, they're not talking about those things. What they're talking about is, look, I have to pick an insurance provider. I don't know who's in that program. And this is where Transcarent sort of steps in. They step in for that employer to say, look, your benefits meeting was contentious last year and the year before and the year before that. And every year you have to tell your employees the costs are going up. All right, so let's address that. Let's make the process of getting people onboarded a lot easier. And then when they need care, they can have access to somebody from Transcarent 7x24, 365 within 60 seconds of their question sort of arising in their head. And then you have that person who's going to help them to figure out where they should go and how they should proceed with care. And that's, when my wife was making a lot, and we know this, that the mom generally makes a lot of the care decisions. Yeah. When my wife was making those decisions, she was constantly telling me how awful my insurance was. And she wasn't really saying that my insurance was awful. She was saying the experience that she gets as a result of having a payer over here, a provider over here, and a PBM over here, and not having the whole thing orchestrated was awful for her. She didn't know where to go. She didn't know where the bills were going to come from. She just didn't know how to navigate it. And then, God forbid, she'd have to see a specialist. And then, a whole new round of complexity would sort of arise. So that's where they're stepping into. It's going to be an interesting play. I'm really looking forward to seeing where they go. The other thing from a success standpoint, Glen Tullman did Livongo, and that team did Livongo, and they did a great job in the initial IPO, and they did a great job in the exit. So, and they've done a good job already with Transcarent raising money. So they have money. They have an experienced leadership team. It's not a tech leadership team. It's a healthcare leadership team. Yeah. So they really understand healthcare. I mean, this thing has a lot of positives going into their launch here, and it will be interesting to keep an eye on this one. And I hope they're successful.
It will be, and I think the other interesting thing here is, as they attack those gaps, attack the generational gaps. If you bring a good point, usually wife's mom's leader of the household are dealing with these things. But recently, my college-age daughter, she's a senior, had an emergency appendectomy, and watching her go through that. Now they got great care, what have you. It's just, again, bridging the gaps. Where do I go? Can I see this doctor after? And it's a little different for the parents, but now you look at that next generation who expects everything at their fingertips, Amazon easy. And it was interesting watching her go through this process. So I think folks like Glen's company is going to, if they focus on that generation, their next consumer, they're going to do well.
Yeah, it's that next generation is like, well, let me get this straight. I have to do this. I have to do this. Can I just find somewhere where I can just buy it? Can I just do a telehealth visit? And it's like, yeah, but it's included in your insurance. Yeah, I'll give you my credit card. Let's just, I don't want to navigate that. Let's just
Very true.
cut to the chase. All right. How have you experienced healthcare during the pandemic? Have you done the telehealth visits and those kind of things?
Yes, I have had to do one. My wife has done a couple. I will say that we've been fortunate enough to get called up for our first vaccine, and I was just amazed on how smooth that was. I was predicting chaos. They had turned a local mall here into a super vaccine site, lots of National Guardmen, which I found interesting, all walking around their cart on wheels, entering this stuff into Epic, and it went much smoother than I thought it was going to be.
Was it run by a health system or was it run by?
Yeah,
It was.
yeah, Atlantic Health here in New Jersey.
Okay. Yeah, that's interesting. The people I've talked to, the experience in getting the vaccine has been pretty good. The gentleman in Arizona was telling me he was in and out within like 15, 16 minutes in Glendale, Arizona. And, in my experience, and so in Florida, it's finally come to an age that I can get lined up. And someone reached out to me, which is crazy. I got an email saying, "Hey, we have vaccine. We're ready. If you want to schedule your appointment." And, it's a reputable player. So I reached out and they're like, "Okay, here's your appointment. You're scheduled. Come on in. You're getting the Moderna vaccine." And, away we go. I think we've worked through a lot of the, let's just say, the learning curve of how to do this effectively.
Yeah, we got a QR code and we're ready to go. But I think one of the things that we have been thinking about at my company is, this the have and have nots. Though it's still amazing where, you know, big company, contacts, and we're, unfortunately have a health issue getting in there, but you wonder sometimes what's happening in the other parts of the country. I live in 45 minutes outside of New York City. You're in a big area. I'm worried about those rural communities. And I think that's one of the things that I'm excited to focus on. And I think as an industry, we should focus on is that patient equity. There's a little bit still too much of the have and have not.
Yeah, no, I agree with that, especially between the urban and rural that exists. Then you have the homeless population and whatnot. I think the homeless population, those who are disaffected in the cities, it really is on the health systems to reach out to them and in a partnership with the agencies in the area, first of all, to find them and identify them, and then to help them to get vaccines. The rural thing was just a matter of, the rural health systems couldn't handle the Pfizer vaccine. It's not feasible.
Yeah.
And so that cut them down to just working with the Moderna vaccine. Well, now we have, the J&J vaccine, and we have the AstraZeneca, I think, is going to come online. Hopefully they got the blood clot stuff worked out. And so we're going to have different options that get to those rural locations that don't require the deep freeze. So we'll see what happens there. The reason I asked you about how you experience healthcare is because I'm exploring this concept of if our habits have changed, and have they changed enough, or are we just going to snap back to where we were? And so there was a couple of interesting stories this week. One was hospital at home and the initiatives that are going on there. And we see them all over the place. There's a new consortium that includes Ascension and Intermountain. Mayo is making noise all over the place on hospital at home. The consortium is really lobbying for better policies and reimbursement for care at home and remote patient monitoring and those kinds of things. And then I also covered a story on Today in Health IT around retail clinics. And it appears that retail clinics are also seeing a surge in growth and really their emphasis in the delivery of care. And I'm wondering, we stopped going to the hospital. First of all, we were told to stop going to the hospital, so we stopped going. And, if we had only done that for 2 months, I think things would have snapped back. But we really have have started to adopt new ways of receiving care, new ways of interacting. We've gotten used to some of these digital tools. We start to recognize when, hey, you know what? It feels like it's okay for me to just talk to a doctor via Zoom. I don't need to, to go sit in the waiting room to wait to see somebody because it's a lot more convenient. As we look at those things, do you think the care venues do you think the habits have changed enough that we're going to see a shift and a change in how care is delivered post-COVID?
I think it's a topic we don't talk about too often because it seems to, I'm not sure if it's embarrassing or, we, at the outset of this, there was a lot of warnings about mental health. We're underestimating the mental health issue that's going to come out of this. And I will tell you, my family, I know some colleagues, friends and family who had never thought about seeing or talking to somebody, what was on their mind, what was bugging them, and have leveraged some of these telehealth services, telemental health services, finally just talk with somebody. Some folks have a problem getting actually that physical interaction of talking about mental health problems or what's on your mind. I think telehealth actually brings down some of those barriers where it might be easier to speak to somebody about your problems or what's on your mind over a video rather than going there. It's a lot of human effort and mind to get up there, get in your car, sit down and talk with somebody, especially about things like that. So that's what I've been keeping an eye on. I have no problem saying I've used it for that purpose. It's been really helpful. And I see that as the big wave. I mean, telehealth with a primary care physician, hey, I've got a rash, those type of things, that's not going to go away. But I really think there's something to be done on the mental side.
Well, I think that's part of what Transcarent is going to do is to align the type of care that you're asking for with the type of delivery, right? So you get on the phone with somebody within that 724, 60 minutes or 60 seconds, you get on the phone with somebody and say, hey, I've got this problem. And they say, great, we'll hook you up with a telehealth consult, or you know what, you need to get to an emergency room, or you can go to a retail clinic. Mm-hmm. They're going to try to match the care with the most efficient model for receiving that care. Clearly the big winner is all of us, but the big winner of really moving forward is behavioral health and mental health via telehealth. I mean, this has been eye-opening in terms of the challenge. Plus, it exacerbated the challenge, right? Isolation is one of those things that just drives people to have those thoughts which can be debilitating at times, and we really need to interact with each other. And so the use of telehealth in that space was a natural fit, and that will be one of the things we all talk about coming out of post-COVID.
Yeah.
We saw that.
I don't like the word sometimes, but I think it's a good explanation. It democratized behavioral health. I mean, now it's available to everybody. I'm excited about it. I'm excited about it because, again, so many people have wanted to go speak with somebody or had something on their mind or something they wanted to fix. And it's amazing that technology could finally address something like that.
Well, I want to talk to you about work from home. There was an article in the Wall Street Journal I covered on Today in Health IT, but I'm going to talk to you about this image that David Chow shared in social media this morning. And it's from a study that Microsoft did on people working remotely. And it really gave them two options: thriving and surviving during the pandemic in your work from home environment. And they broke it down by business leaders, married, working mom, Gen Z, frontline workers, new employees, and single. All right, so we'll play a little game here. Thriving and surviving. If you are a business leader, what percentage do you think are thriving in this new remote work environment?
That depends, right? I think as engineering coders, I wouldn't say they're thriving. We've all sort of adjusted to figuring out how to, in such a collaborative process, especially developing software, being in the office is probably missed, but That's a 50-50 shot for me.
Yeah,
You know,
it's
I'm,
61% say they're thriving.
really, yeah, I'm a
So
bit of an introvert, so I like that quiet time sometimes to get things done. Maybe it's the engineer in me, but I think that type of person or that type of job profile could thrive in this. It's great. Sometimes I get 2, 3 hours of work done, go do something, take a hike, take a walk. You don't get that at the office sometimes.
yeah, exactly. You just go from meeting to meeting.
Yeah.
All right, we'll play a little Price is Right. This is a better way to do this. So, married people who are married who are doing the remote work thing, greater or less than 40% are thriving.
I'd say less than a marker.
It's actually barely greater. It's 46% say they are thriving. But again, that's a 50-50 proposition there, who are saying, look, I'm struggling with this remote work thing as a married person. Single, greater or less than 40% are thriving. You're trying to look this up on the internet right now, aren't you?
No, I just grabbed some water. No, I'm not cheating like that.
It's actually less. So single, they're saying only 30% are thriving and 70% are struggling. Interesting. And actually a lot of these, working moms is roughly 50-50. Gen Z is 40% thriving, 60% struggling. Frontline workers, 40% thriving, 60% struggling. New employees. Now, I will let you guess at this one. How many new employees do you think are thriving in this new environment? So they started, let's just say they've been with the company less than a year. What percentage do you think are thriving in this remote work environment?
Oh, it must be near 5% because I know I'm trying to. What's the number?
The number is 36%, but
really,
yeah, that's a lot higher than I would think it would be.
Yeah, we've brought on a lot of new employees, and we're taking an effort to really reach out to them, virtually put our arms around them, because talk about a hard time to start a new job and not meet people and be isolated. It's taking a lot of extra cycles from all of us to get those not folks only up to speed and make them feel part of the culture. But I think that's really high.
Well, you guys are a tech company. Do you think you'll go back into the office when this is behind us?
Yeah, I think it'll be a hybrid. I think, and that's that article you guys talked about. It's maybe similar to tech in the cloud. I think everybody thought that is great. I can move out of the Bay Area. I can live in Kansas, but everything ends up being not so black and white. It ends up being a hybrid. So we will see. We will definitely be a hybrid company going forward. It's opened the job pool up for us. I think that's an interesting side benefit of this. I have a friend who's going to work out of Greece for a month. So now we can pull people that were once just in the Bay Area, but we can pull people in from anywhere around the world. So it will be hybrid, and I think we're actually going to get a new diverse set of talent.
Well, and the crazy thing is, like where you live and whatnot, there's bidding wars going on in these remote areas. So people moving out of New York City into Jersey, I've heard of people bidding up houses, $50,000 to $100,000 just to, it's.
My wife's a real estate agent and has never been busier, and we've always had a second place out in Colorado, and we went out there to try to fix it up, and it's just everybody's moving everywhere up into the mountains, so it's driven everything up. It's quite crazy right now.
Yeah, we have friends who just moved to Montana. I'm like, does Montana have the internet? I don't know, but it turns out that they do, and it's a good place to work from. Yeah. So you go to hybrid, and somebody's moved to Colorado during the pandemic. I mean, are we going to say to them, hey, look, your home office is New Jersey, and you have to be in the office 2 days a week?
Again, I think it's all going to depend on role. If you're customer facing, and eventually we will be out there in front of our customers, with our customers again, and partnered, it all depends on the role. I think being a tech company and so global, I think one of the issues we're running into is, and it has those silly time zones where, is California the place now? It's a tough it's a tough time zone to take care of EMEA and APJ. My boss is in India often, and trying to find that time is tough. And now you take that and spread it across, 3 geos, 6 different time zones. It's tough.
Yeah, I used to travel, like, I think the year I traveled the most was 42 weeks. I was on a plane, and I used to be really good at time zone math. I found that that is one of the skills that I've lost with not traveling is time zone math. I can't tell you the number of times I've said to people, yeah, we'll meet at 3 o'clock Central, and I do the math in the opposite direction. It's
Yeah. Hey, maybe we'll come up with universal time, right? Universal. Somebody will come up with a universal time or some algorithm to fix this or to address it, and we'll just call it this time. And obviously where the sun is and times, but there's a lot of talk about this daylight savings work any longer. It's amazing. Back to the snow globe, it's making us rethink about things like that. Time zones. Where do you work? It's fascinating.
so what's next for VMware? What are you guys focused in on, and what are you doing?
Well, you know what? We our healthcare journey started 2005-ish when we were starting to work with the pharmaceuticals. We had this crazy idea of a hypervisor, and the pharmaceuticals issue was, how do I move workloads into research environments? And if I have to change the hardware out or software, that could take months to recertify against the FDA. And that's where we took this idea of a hypervisor and sped that up. Now, we moved over into the provider side and we said, what are some of their issues they had been dealing with? And it was, boy, we going on some rounds to see, and this was a long time ago, but yellow sticky pads with passwords on every nurse's station. And we worked on some VDI solutions. That's where our always on point of care had come by. But, I'm proud of what we've done over the last 10 years with our high tech and EMRs running on VMware. And I think we've been sort of, what's the word? Typecast to some degree. We know that VMware thing, it really helped us a long time ago with the server consolidation, but with work from home, care at the edge, the cloud, like I said before, everybody was running to the cloud as to do everything there. And it's going to be it's going to be a hybrid experience. So what we're really focusing on is get that value proposition that the company was built on in terms of moving a workload from any server or letting it go to a desktop and VDI. Can we extend that into the cloud? And I'll let you run your VMware workload with our relationships with Amazon, Google, and Microsoft to extend that VM to go out there. But even taking it one step further is using the Kubernetes container as the new workload, the container, so to speak. So this whole idea we have is, we need to help simplify healthcare IT. There's a lot of simplification to be done. There's too much complexity. We can bring automation to it. The second side would be is modernize. There's a lot of technical debt out there, both from a hardware application perspective. So working on helping companies modernize both healthcare IT as well as ISVs, application providers. I think that's going to open the world up to this innovation. I keep on using the snow globe analogy. It's if we can simplify things and get more smart people focused not on looking at that red button of something going wrong and making sure you hit every Tuesday and getting to work on innovative products and projects, that's what we're looking to. And I'll leave you with this. It's this working from home, care at the edge, care in homes. We have a lot of work to do as an industry to secure those devices. It's the Wild West out there. During COVID, PCs, devices just ended up everywhere. And now as we sort of try to rationalize that, and we don't want to take those back, right? We care at the edge is great, but now we need to figure out how to lock them down and make sure that person, that teleradiologist, that caregiver, that patient has a great experience. Because if they don't, they're going to be coming back into the hospital. And that's something, we don't want to lose those, the gains we made through telehealth.
Yeah, and one of the biggest challenges in the security front has always been the biomed devices, and now we're talking about these, hospital at home. We're talking about these devices going into the home that really raise the level of acuity that we can do out of the home. We did some interesting things to secure them in the in the hospital setting. But I'm not sure those same methods work once we move them to these remote locations. And there's a lot of it's you can tamper with those things and cause harm. You can tamper with those things and collect data, and you can also use them as a gateway into other systems which might have more valuable information depending on how the transport mechanisms are secured. So that's one of the areas that I think there's a significant opportunity for someone who is going to secure all those devices in the home. That'll be an interesting space to really keep an eye on.
Yeah, there's I want a shout out to John Gomez and Sensado. I think that if you want to know anything about securing devices, medical devices like that, John Gomez has been working on this forever. So check out his website. He's got some great blogs out there as well. But you're right. It's different about having a PC in the user's home. We know how to take care of that, but we cannot let that managing and securing that medical device from any manufacturer, God knows where it's coming from. But think of hacking a Windows desktop has become pretty routine. You really just can't do that with these devices. It's going to take a different type of thinking.
Well, Frank, thanks again for all the referrals. Thanks for coming on the show. I appreciate it. This great conversation, and always appreciate your support of the show and all the things you've done to get us to this point. 3.5 years. I can't believe it's been 3.5 years. Crazy.
Yeah. Well, we really, you provide a great service to the community, a great service to my company. This is something I really championed when I was in the CHIME board, the CPAS event, trying to get the CHIME CIOs and foundation members to communicate better, learn from each other, and you've just certainly amplified that globally. So we appreciate all you do for us.
Appreciate it. What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.